I think vitamin D is extremely important along the vast spectrum of health. I think vitamin D is going to continue to be important. I test for it a lot on my patients. I diagnose a lot of vitamin D deficiencies. I do think that people should take vitamin D supplements and keep that vitamin D at a good level. There's a lot of ways vitamin D impacts the body, most importantly with bone health, et cetera. But more true to what you're asking me, they're finding a lot of studies that suggest that people that have, COVID, that are infected with COVID, are having decreased levels of vitamin D. And they're also starting to find a little bit of correlation between severe COVID cases and the vitamin D deficiency. Now, just because they're finding that, and that people with severe COVID cases have vitamin D deficiency, I can't extrapolate that data to suggest, well, if you take vitamin D supplements, then you have a lower risk of getting COVID or getting a severe case of COVID, because they have not studied that specific question yet. They're in the process of doing that. There's some relatively prelim data that's coming out, and here comes my caveats. This hasn't been put through the rigor and the machine of medicine to try and determine whether or not the data is sufficient or they have enough numbers. But studies can suggest that, all right, these cases, common sense would think that if you have lower vitamin D levels in severe cases, perhaps supplementing it would reduce your risk of severe cases. Correlation has not been found, but it's been suggested, and certainly there's nothing wrong with taking a vitamin D supplement. Vitamin D receptors have been found on a lot of things, specifically with a lot of the immune response, which is where the study with COVID comes into play. Vitamin D deficiency, vitamin D levels have been shown to be low in people with significant asthma, people with significant autoimmune diseases. People with vitamin D deficiencies can have muscle weakness. They can have issues with their bone and bone development. It impacts a lot of other systems. So it is pretty important in your overall health. It can lead to a lot of nonspecific symptoms, as well as some pretty significant diseases if left unchecked.